Did You Know video series from the National Cancer Institute, Risk Factors for Cancer. Did you know that a person's age, lifestyle, environment, genetic makeup, and family history can increase the likelihood of developing cancer? These are called risk factors. Advancing age is the most important risk factor for cancer. The median age at diagnosis for all cancers combined is 66 years, and 1/4 of new diagnoses are in people ages 65 to 74. Many risk factors are related to a person's lifestyle or overall health. Excess body weight contributes to 1 in 5 cancer-related deaths in the U.S. Obesity increases the risk of breast, colorectal, and other types of cancer. Carcinogens are substances that cause cancer by damaging DNA. One common example of a carcinogen is tobacco, a proven cause of cancer. A person can be exposed to tobacco by smoking cigarettes, cigars, or cigarillos, or by using snuff or chewing tobacco. They can also be exposed by inhaling tobacco smoke from smokers nearby. This is called secondhand smoke, or environmental tobacco smoke. As depicted on the screen, smoking accounts for at least 3 out of 10 cancer deaths in the U.S. Tobacco is most infamously associated with lung cancer, but it also causes throat, stomach, pancreatic, and many other cancers. Drinking alcohol increases the risk of developing cancers of the mouth, throat, esophagus, larynx, liver, colon, and breast. The more a person drinks, the more likely they are to develop cancer. The risk is even higher for those who drink alcohol and also use tobacco. Environmental and chemical carcinogens are responsible for up to 19% of cancer cases. Individuals may be involuntarily exposed to carcinogens if they work in certain mining, welding, agricultural, manufacturing, printing, or painting industries in which they are exposed to substances such as those shown here. Exposure to these substances may lead to many types of cancer, including lung and bladder cancers and leukemia. Natural and artificial UV rays from the sun or tanning beds can increase the risk of developing skin cancers, including melanoma, basal cell skin cancer, and squamous cell skin cancer. Some viruses, such as human papillomaviruses, hepatitis B virus, hepatitis C virus, and several others, can increase your risk of cancer either by damaging DNA, causing chronic inflammation, or weakening the immune system. It's important to be aware of your risk factors, even those you can't prevent. For example, inherited genetic mutations play a major role in 5 to 10% of cancers. In breast and ovarian cancers, certain mutations in the BRCA1 and BRCA2 genes are well-known risk factors. Genetic tests can tell whether a person has one or more of the inherited mutations that are known to increase cancer risk. However, not everyone who inherits the mutation will develop cancer. Talk with your doctor about genetic testing if you think you may have inherited a mutation that increases your cancer risk. You can also ask about prevention and testing related to HPV, hepatitis B and C, HIV, and other infections. To reduce your overall cancer risk, maintain a healthy weight through proper diet and exercise. Protect your skin from the sun, and don't use tanning beds. Don't smoke or use other tobacco products, and limit alcohol intake. For more information on risk factors, go to cancer.gov or call 1-800-4-CANCER. For more cancer statistics, go to seer.cancer.gov. U.S. Department of Health and Human Services, National Institutes of Health, National Cancer Institute. Produced May 2018.